Assalamu alaikum. This is Dr. Hussain Bashkulachi YouTube channel, and today our topic is related to the health workforce shortage in Pakistan and how we can address this. And you can see that the health worker picture by AI shows that almost the building is empty and only one health worker or health workforce is available. So this shows that how beautiful buildings are there, but still the human resource and the required manpower in Pakistan and even in many other countries is this problem, and WHO is just giving the list of many countries in which Pakistan is one of the country where acute shortage is mentioned, and day by day, the out migration or leaving the country, as well as brain drain and leaving the profession, going to other lucrative jobs is another problem, and even the training as well as the disease pattern is putting so much challenge that Pakistan is facing not only communicable, non-communicable, but the climate change effects on the health and human life. So let us start with the first slide. So this is important understanding the systemic shortfall in national health care. Pakistan faces a critical imbalance between uh, its 231 means almost 23 crore, but now it is almost 25 to 26 crores, and the number is more. But however, this is from the Google and available data, citizens and available qualified medical profession. Medical and dental schools, their number is 176. Yet the health system remains chronically under-resourced compared to WHO standard. Means the resources provided for the training, for the learning, even for the treatment and drugs, brain drain effect over uh, uh, 6 lakh. The exact figure, highly qualified and skilled people have migrated since 1971. Uh, so the figure is almost 6 million. Uh, so accessibility and quality care standards are severely challenged by a population that continues to grow rapidly. Professional retention, educators, and policymakers must address why the state trained professionals, means on the taxpayer money trained professionals, are increasingly viewing their future outside of Pakistan. They don't see their future, good future rather, in Pakistan. So this is a fact, but later I should uh, see that it is 6 million. Yes, yes, 6 million. I have counted again since 2.5 crore people have left this country. So quantifying the terms and other things, uh, exodus of medical experts in 1971 to 2022 data reveals a consistent loss of health care human capital to international markets. Doctors, the largest number, and from 71 to 22,000 means 3, 4 years ago, the figure might be more. 31,000 doctors have left this country, 12,000 nurses have left this country, and uh, so Let us see the other figure. Yes. This is another important that according to this professional migration, you can see that 83,200, rather 8,32,000 total professionals have left this country, and this average is 2,312 average daily departure. Huge professional loss to Pakistan. Root causes: politics, economics, facilities, career, security, conflict impacts professional safety, uncertainty hinders long-term planning, economics, low pay and high inflation versus global attraction, career, and last is lacking technical and research facilities. Impact on academia, you can see that the faculty is migrating, global ranking is decreasing. It says ranking suffers as researchers move. Only 2.89% of ACT index journals are in the Web of Science. Only 3% almost. Declining productivity. Research productivity shows a decline trend correlated with the migration of 17,000 individuals. Reintegration is less. So this is just a tip of the iceberg. Most of the people creates a teaching gap, and faculty migration leads to the loss of scientific invention and intellectual property. 15 billion annual economic and human cost is annual economic loss, essential loss, 15 billion US dollars. You can see that this is a huge number resulting from physicians' migration for low middle income countries, from low middle income countries occurring to accounting to mortality linked to health workers shortage. So you can see that how much is from the middle income countries and affected nations. Pakistan is identified as one of the 4 primary nations bearing the brunt of these costs alongside India, Nigeria, and South Asia. Human life cost, remittances from migration professional fail to compensate for the cost of overstretched domestic health system and the transfer of pre-trained expertise. So this is an important aspect. Rural-urban disparity is another problem. The shortage is most acute in rural areas where professional deployment remains a persistent shortage, particularly the ladies and lady doctors, their security. WHO estimates a projected global shortfall of 11 million health workers by 2030, affecting underserved rural population. Remote districts in Balochistan and Khyber Pakhtunkhwa face extreme shortage of medical staff. Cities like Lahore, Karachi see the highest concentration of medical profession, and here you can see there is a shortfall. Public health inequality leads to higher maternal and infant mortality rates in regions depending on limited community health worker. So this was perhaps the urban rural and then strategic roadmap to retain medical talent, financial incentives, infrastructure, political stability, medical education, curricula focused on domestic needs with market-based local pathways, repatriation program, diaspora scheme for overseas professionals to contribute expertise, competitive salary structure reflecting professional value and education cost, advanced technology-based research centers for modern medical practice. So this is perhaps the second last slide. Yes, last slide. And securing the future of health in Pakistan, the crisis requires immediate intervention to preserve the prosperity and resilience of the nation. Talent protection, transition from exporting talent to nurturing and protecting vital human capital, sustainable growth, investing in health workforce, secure socio-economic growth for future generation, migration crisis, 6 million professionals migrated over 50 years, a wake-up call for leaders, including the doctors, nurses, and other professionals, prevent further collapse of academic standards and unequal health access both. So with this, I think we are concluding, and as the PNM physician and nurses midwife ratio, WHO says that it should be more than 43 or 43, and in Pakistan it is almost 17 or 18. So this much gap is there, and we cannot provide the universal health care. We cannot eradicate polio. We cannot provide the health care and even standard diagnosis, treatment timely to the majority of the masses and mothers, children, as well as the vaccination programs. They are also suffering from these overall shortage of health workforce. So with this, Dr. Hussain Bashkolachi YouTube channel is giving you the latest situation in Pakistan, according to which almost we have every problem in our healthcare system. Once again, you can see that the first slide, we should see that the first slide once again reflects that the buildings are there, but health workforce or the workforce and professional force is weak and weak. Thank you very much. Please like, share. We are giving this public health point of view to our Pakistani as well as to the underdeveloped and middle income countries. And the situation is before you, and health is wealth, and the investment in the gold is not as important as in the investment in the health. So please like, share, and forward. Thank you very much. And I think you have at least some kind of knowledge with you about the health workforce, which is least discussed in the clinical subjects. So with this, thank you very much.